Okay, so hi everyone. My name is Dana Rusch, and I'm here to talk with you a little bit more today about some resources related to mental health promotion and linking families and community members to services related to mental health and wellness. And so I have a few directed questions that were fielded by you that I'll try to answer today, but wanted to just start out by giving a little brief introduction of who I am. So I'm on faculty at the University of Illinois, Chicago in the Department of Psychiatry. I'm a clinical psychologist by training. And I also created and direct the Immigrant Family Mental Health and Advocacy Program at our Institute for Juvenile Research. So I'm going to talk to you a little bit about what that program is, just because I think it will help kind of situate me and situate some of the resources I'm going to be providing to you today. So this program has three different components to it. So it includes some clinical services. So these are direct outpatient services to children and families. I'm a child psychologist by training. It also includes some community engaged research components and also a strong kind of policy advocacy component. And these three areas were really designed to be integrated and kind of intersecting because they all are informed by the global context of forced human migration, systemic inequity, and the marginalization that a lot of immigrant and refugee communities experience, not only here in Chicago, but nationally and globally, and really critical, the policy level impacts on mental health. And then I'll talk a little bit about the ways that I've leveraged some local collaboration and resource development to really support this program. So briefly, I just want to talk to you about, I do have some clinical services that I provide to kids and families in our outpatient clinic in child and adolescent psychiatry at UIC. These are meant to be kind of empowerment based and advocacy focused and a lot of intensive case management. I work mostly with K through 12 students, but also work with some UIC students who are impacted by immigration related stressors, and also unaccompanied minors who are seeking asylum and who are young adults awaiting the adjudication of their asylum claims. So I have kind of a mixed caseload there. But just wanted to make sure that you do know I do have some of those services available, but I'm only in the clinic about 20% of my time. A lot of the time I spend doing a lot of research, mentorship and training of students, not only students who are being trained as clinical psychologists or psychiatry fellows, but also students who are interested in research and understanding the policy level impacts on mental health. And so you'll see some examples on the right side of the screen here on just some recent publications that are related and focused more on the role of community-based organizations and in the promotion of mental health and the well-being of immigrant communities, which is something that I focus a lot of my research on. And lastly, I focus a lot of my research on culling from the literature to pull together specific policy recommendations to our elected officials on how to put research into policy action. And so here are some examples of how I've done that, both kind of at this kind of local level, but also with some kind of national efforts related to understanding the effects of immigration enforcement on the mental health and well-being of immigrant families and communities, and being able to use those policy statements not only for legal proceedings, but also for advocating for more just policies at our local, state, and national level. So that's just kind of a real quick, brief overview of who I am and what I spend my time doing. But I really want to talk to you today about some critical questions that came up that can help us talk a little bit more about how to support the mental health and well-being of the families that your welcoming centers are working with. And so one question is, what are some of the key things to keep in mind about the mental health and well-being of the immigrants and refugees that you serve? So I want to start out by just putting into context, when we think about migration, we think about immigration, we are often thinking about families or individuals at this kind of post-migration stage. So once they've arrived, either here in Illinois, Chicago, in other parts of the world, and all of the various stressors that, that they contend with. But I do want to kind of widen the lens a little bit here to make sure we're thinking through what happens kind of pre-flight. So what are the push and pull factors that are part of the decision to leave one's home country, oftentimes with in a forcible way. And so these are violence contexts, this is war and unrest, these are climate and natural disasters, economic instability, family separation due to kind of transnational relationships between the US and other countries. And then what happens kind of during migration, ongoing family separations, detention by authorities, interactions with new and different systems. And so when we think about this broader context of migration, we can see that at every level of this, there's a possibility or an opportunity for adversity, adverse events to occur, which compound one's ability to kind of navigate stressful situations and to navigate the stressors of migration. And so just wanted to give, I think this is a slide that really highlights all the things to keep in mind when we think about risk and resilience in immigrant and refugee communities. So when I think about mental health, I do want to give you a sense of how I think about mental health. So I'm a trained clinical psychologist, which means I do a lot of outpatient clinic services. But if you remember from those previous slides, I spend a lot of my time in kind of thinking through as a community engaged researcher and policy advocate about how can we do mental health differently. And so this is an example of the work that I do with a larger team of researchers at the Institute for Juvenile Research at UIC, where we're really trying to think about new and innovative ways to support mental health and wellness for kids and families, not only for immigrant and refugee families, but kids and families that have typically been marginalized or kept out or left out of traditional mental health services. So you see on this left side, this kind of pyramid, right? So we often think about mental health services at that targeted level. So when we have really intensive needs that need real targeted interventions, that's where we think about kind of specialty mental health coming into play. So clinics, highly trained professionals such as psychologists, social workers, psychiatrists. But what my team spends a lot of time thinking about is the idea of prevention and early intervention as it applies to mental health, just like we think about prevention and early intervention when we think about public health. We don't often apply this thinking to mental health. And so what we really spend a lot of our time doing is thinking about the where, the who, the what, and the how of mental health. So we really think about mental health as happening in the settings and places that kids and families spend their time. So these are homes, schools, community settings. The who are like, who are the people that are maybe key opinion leaders and non-traditional providers in those settings, like teachers, coaches, community-based organizational staff. And then the what, so how do we align mental health with the goals of these settings? So how do we align mental health with learning, for example, in schools? How do we align mental health with conflict resolution and emotion regulation in an after-school setting, for another example, because that really allows us to hone in on the how. So what are some messages and some key kind of modeling techniques in those contexts? And this is what our team spends a lot of time thinking about. So given that I'm talking with folks who are in the CBO setting, this really aligns very nicely with the way I've thought about a lot of my work so far, is the critical role that community organizations play and the staff at these organizations in promoting the mental health and wellness of immigrant and refugee communities. And so I've spent a lot of time thinking about, well, how would we use these settings in a way and leverage the knowledge and skills and resources of these settings to promote mental health and wellness. And so I have some ideas around how do we support parents? So again, I'm a child psychologist, so I spend a lot of time with kids and families and a lot of time on thinking through how to support parents and how do we keep that advocacy goal in mind? So with a sense of kind of a focus on empowerment, building self-advocacy skills in order to navigate systems and settings. And so I'm going to talk to you based on that model about a few strategies or techniques that I hope might be helpful to you to think through. And of course, you can always contact me in the future to have further discussions around this. But I want to talk about some strategies around how to support parents. I want to talk about some strategies about like, well, what is kind of some models around kind of family mental health advocacy, and what are some tips around psychological first aid, which you may have heard of, and the ways that we might think about that or operationalize that. Using some slides from my Coalition for Immigrant Mental Health, which I'll also talk about in a few minutes. Okay, so first I'm going to start out with some parenting supports. So again, I focus a lot of my time on working with kids and families, and parents are such critical change makers in the lives of kids and in the communities that they live within. And just because someone is an immigrant or a refugee doesn't surpass their role as a parent. And so a lot of things that feel out of control or out of the realm of their control related to policy, related to kind of community contexts, we can leverage and build some sense of empowerment when we focus on what do you need in your day-to-day to feel successful and supported and empowered as a parent. And so my team and I worked with 4 social service agencies on a program called Partners Achieving Student Success, where we focused a lot on this, really distilling key messages from the research literature on what helps parents feel supported, what are some key skills that parents kind of can master and practice to help them feel more empowered in supporting their kids. And you'll see these 6 key skills on the left here. So they're not anything drastic. They're kind of day-to-day support. So reading, homework and home routines, positive discipline, how to build family school connections, how to reduce stress. And so if you're interested in these kinds of key skills, they were designed with paraprofessionals in mind. So the folks who delivered these key skills and coached parents in these key skills were not psychologists and social workers. They were community members of the community working in school teams within social service agencies to really support parents. And so the QR code on the right here, you can pull up. I'll walk through a little bit of this in a few minutes, but where you can see those key skills, we have them available in English and Spanish. They're available to you free of charge. The one thing I ask you to do is if you do want to use these in your organization, please just in the PDF in this QR code, you'll see like another survey link. Fill out the survey and just let us know who you are, how you might intend to use these, just because it helps us gather some data on how they could be useful, and also helps us gather some data on maybe the need for translation or adaptation of these skills to other languages or other subgroups. Okay, so, and then I'm going to walk through a little bit more about what I'm thinking when I talk about family mental health advocacy. So this is one thing that I think the parenting skills is one piece. The other piece of this is how do we really leverage and acknowledge and build upon the capacity and the content knowledge that you have as community staff who have a history of working with immigrant and refugee communities. So how do we kind of talk through and think about that contextual knowledge? So what types of things impact mental health? That kind of harkens back to that slide I presented a few moments ago. What are some ways that you can build in advocacy skills into your kind of day-to-day supports for families? And are there some ideas that we need in there to help have conversations with parents about psychoeducation? So how to talk with parents about things like anxiety or depression or psychological distress, how to identify learning challenges and interacting with the school system. And so here's kind of an example of how I might do that in my day-to-day outpatient work, but I think it's applicable to settings outside of the clinic. In fact, I think it's applicable to anyone working with kids and families. Is really like everyone has a role to play. Parents have a role to play, children and adolescents have a role to play in their life and in navigating the systems that they're part of. And also I have highlighted here the role of schools, because I do a lot of work with schools and teachers are so important for kids and families. And so this gives you kind of a framework for how you might be able to kind of action plan with a family and come up with a plan where everyone kind of has some steps and you can kind of work together on identifying things that can improve some outcomes for kids related to school and their mental health and well-being. So I'm going to walk through quickly. So you might have heard a lot about psychological first aid in the literature. There's a lot of talk about the application of psychological first aid to community settings here, nationally in the US, but it really was originally designed to be implemented in kind of emergency response situations. So in response to a crisis, like a natural disaster, and was intended to be delivered by kind of non-mental health providers in those disaster situations. And so it's really there's been a rapid proliferation of using this approach in community settings to address kind of non-disaster situations, but maybe high stress contexts. So like the high stress context of increased immigration enforcement, for example. I do want to highlight that you can get more information about psychological first aid training from the link here by the National Childhood Traumatic Stress Network and some other places. But I do want to caution that we still don't have enough research on kind of what's the effectiveness of using this approach kind of across different target populations and outside of that kind of disaster relief context. So it is important to kind of keep that in mind as we're thinking through it. But the next few slides, and you'll have a copy of these slides, I'm sure. So I'm not going to walk through all this information, but these next few slides take the 12 steps of kind of psychological first aid that have been adapted by the American Red Cross, or from the American Red Cross, by my Coalition for Immigrant Mental Health, to kind of like really take these steps and try to operationalize them for you. So like, what are some steps you can take to support your community using this model as kind of a framework? And so this gives you some examples of how to do that. And you'll see some notes underneath each of these steps to kind of bring this to life for you. And you might see as you're reading through this that this is really resonating what you're already doing in your practice, or what maybe you could be focusing on more in your day-to-day practice with families that you and individuals that you're working with, and just thinking through it as a mental health support, because the information and the assurance and the support that you provide to families is in and of itself a mental health intervention. And these steps really highlight that. Okay. So the next question that came up is, are there webinars or conferences, kind of different networks that can help build kind of capacity and skills, particularly as they relate to supporting mental health? And so I'm going to walk through a couple kind of more local resources for you, and also kind of a more national resource which I already mentioned, which is the National Child Traumatic Stress Network, to give you some places to start, some places to go to. So, and after I walk through all these, I'll demo some of these. I'll stop sharing my screen, my presentation, and demo this online. But the Coalition for Immigrant Mental Health is a coalition that began here in Illinois and locally in Chicago is kind of where we started back in 2016. That involves multiple stakeholders who are involved in immigrant justice activities. And so this includes practitioners, direct service providers, researchers and scholars, community activists and community organizations, policy advocates, legal advocates. So really a lot of trainees and students, and also directly impacted community members. And we really wanted this coalition to be focused on supporting mental health and wellness through different action areas. So through education and outreach, research and data, and then policy and advocacy. And so on this website, we have a lot of information about upcoming events, convenings that we host, which also include a lot of kind of panel discussions and educational information for folks. But also a resource directory. So where can you go, particularly for mental health resources? And I'll demo where you can find that in a few moments. But this is a really great resource for you. And you can also join our listserv And the listserv is used for lots of different ways for communicating information about resources, webinars, meetings, but also when people often use that listserv for looking for referrals for maybe a family or an individual that they're working with. And it's a really great resource to have in that sense. Okay. So additional resources that I wanted to highlight is, again, I've mentioned this website a couple of times. The National Child Traumatic Stress Network has a wealth of information that is trauma informed and kind of contextually and culturally relevant for working not only with immigrant and refugee communities, but also other communities that have been impacted by trauma. And so I think that this is just such a great website to have. It can be a little bit overwhelming because they have so many resources there, but I'm going to show you how you can kind of filter and search by key terms to find some of the information that may be useful to you, including webinars and training and educational materials, but also kind of outreach materials for families and community members as well. And then the Center for Childhood Resilience is located at Lurie Children's Hospital here in Chicago. And they do have kind of a virtual learning community. From what I can tell, it is free of charge, where you can kind of get together and find some training and resources. And they really focus on kids. They focus on risk and resilience, but they provide a lot of, I see them as almost like a local focus of something that the National Childhood Traumatic Stress Network is doing. And so it's really nice to have those two things kind of working in tandem. Okay, so the last question is, are there funding sources to help CVO staff? So for things like attending conferences, getting more training opportunities. And so I'm gonna talk again a little bit about the CIMH and also talk a little bit about some resources that the UIC can offer. So the CIMH, once again, has a website that we often offer conferences. We actually do a community meeting every year. This past year during the pandemic, we've had a series of virtual convenings that have all been recorded, and you can find them online. And you can join one of our work groups in our listserv that maybe best aligns with maybe where you might want to get more training or get more information. So I will encourage you to go to our website and kind of find out a little bit more about what might be helpful and useful to you in terms of attending conferences or additional groups and training opportunities. But it's really a great way to network and to learn from other folks, not only in the Chicagoland area, but kind of across Illinois that are doing this work, and how to kind of build some a community and get some input and support that way. And then the one resource that may seem a little bit different than the other resources I've mentioned so far, the other resources I've mentioned have been really focused on kind of mental health services directories, psychoeducational materials related to trauma or psychological first aid, or provider supports. This particular resource is part of our community engagement and collaboration core of our Center for Clinical and Translational Science here at UIC. So this is a nationally funded grant, and I'm part of the community engagement and collaboration core of this large CCTS at the UIC. At UIC. And so there is a contact form that if your organization was looking to partner with a research team or was looking for some consultation on a research grant or a funding opportunity that you were seeking for your center, you can request kind of a meeting with us, and we can kind of sit down and kind of work with you and provide some guidance and some consultation around those things, or perhaps link you to some other folks at UIC or within other academics within the city that can work on this. We partner a lot with the Chicago Department of Public Health and the other translational science centers in Chicago. So UIC has one, so does U of C, and so does Northwestern. And so we have a lot of this activity kind of going on in our city, which is really, really exciting. And then lastly, this other link that you have here is there's a research ethics training that was developed by UIC specifically for training community members for the participation in research and kind of ethics around kind of research and research partnerships. And this training is available currently in English and Spanish, but it might be a really nice tool for welcoming centers and for staff to know of, even if they wanted to just become more familiar with research so that they feel better equipped and better positioned for developing those research partnerships with you know, whether it's with UIC or any other kind of academic or research institution. Okay, and so here is my contact information. You can contact me by phone. Email is probably the easiest way to get me. If you had any questions about some of this information or wanted to talk through some of it more as it relates to your specific welcoming center or your specific goals or questions. And what I'm going to do is I'm going to stop sharing this and I'm going to pull up my my online. Let's see. I'm going to see if I can do this. 1 second. It's not letting me do that. Let me just want to demo some stuff for you. Okay, so I have some resources pulled up here and I thought I would just walk through them with you. So this is the main page, the homepage for the Coalition for Immigrant Mental Health. We are kind of updating this website regularly. So, but you know, the taskbars across the top should stay pretty consistent. So just wanted to walk through how you can find different things on this website. So you'll see that we often put out some statements on kind of local events and policy issues. You're going to see a little bit about the work group meeting schedule here on our main page. And if you wanted to attend any of our convenings, right now we're still doing most of our work virtually, but hope to kind of restart some of our meetings in person, perhaps in the fall. But I want to show you, let's see if I can move this, resources. So if you click on the resources tab up here on the top, you're going to see, you know, this drop down menu is going to give you a lot of different resources. What I want to walk through with you is this second tab, which is the mental health resources. So you can click on this and we have a resource directory. It's available currently in English and Spanish. And this gives you a list of, I'm going to click on it, see if I can pull it up for you. Gives you a list of resources by kind of area in the city. And so, and it gives you information about, you know, what, if waiting lists, about what insurance is accepted, or if they accept people on a sliding scale, or those who are uninsured or undocumented. And so, and it walks through by kind of area. So I think this is really helpful for people to have in terms of knowing kind of where to go and where to start. So oftentimes when people come to us with a request for services, we really direct them to look at our resource directory first. What we're working on with this resource directory is making it a little bit more user-friendly. So I encourage you to kind of come back to this often. We're going to be doing something where you can search by language, you can search by site, so making it a little bit more searchable. But as you can understand, that takes a lot of time to get that together, and we're a volunteer coalition, so everyone's kind of doing this work kind of on kind of their donated time. But keep an eye out for those resources. But I think that's a really great place for you to go. So the second place I wanted to show you is more of a national resource. And again, this is more focused on childhood trauma, but they have a lot of resources in the form of kind of webinars, presentations that you can watch for kind of training purposes, but also educational materials that are outward facing. So for parents, community members, teachers, for, you know, children themselves. And so you can scroll up here and search out different things. So you'll see here, they have something on psychological first aid, which I referenced in my presentation. And then they have a whole bunch of resources. So training, public awareness resources. I'm going to type in here just to show you. Oops. just some, if you use a key term, so immigrant, you're going to find different resources here, and you can search by resource type. So their webinars, are there fact sheets, different tip sheets, resource guides. And so, you know, I encourage you to kind of get familiar with this website. You might find information in there that you find is really helpful to you in terms of your own training. You might find that there's some fact sheets or information, and it's often provided in different languages for families or individuals that you're working with. So I think that's another really great resource to have. And then lastly, I wanted to show you the Center for Childhood Resilience. So again, this is a center that's located within Lurie Children's Hospital downtown. And they have this option for a virtual learning community. And you can see here that this goal is to provide kind of free training and education to help educators, clinicians, parents, and caregivers, you know, better support the mental health of children. And so this might be a really great resource for you. And there's information down here on how to join. I think you probably just need to register and you'll get more information about that. But again, it's kind of all with the goal of getting some more information and maybe some training around mental health, an introduction to trauma, an introduction to working with kids. Again, they talk a little bit about psychological first aid and just self-care as a provider. And so this might be a really great resource for you. So I wanted to make sure that I walked through that with you. And then let me see if I can get my last one here. Hold on. Oops. I can't seem to get to my, there we go. And then the resource that I mentioned to you about how to connect with kind of the Community Engagement and Collaboration Core at UIC, this is our main page, which I included the link in the presentation. You'll see here that you can scroll down if you need kind of a consultation, a presentation, if you're an organization or a researcher that needs a letter of support for something. And we kind of break this down by like, well, where are you in this stage of your work? Do you need help with project planning and design? So for example, are you a community organization that's looking to really kind of partner with a researcher around understanding the needs in your community and maybe starting out a program evaluation of some sort? That might be, you might be in this kind of project planning stage. And so we encourage you to kind of look at this website to see if this might be helpful to you, including any upcoming trainings. We have some toolboxes on how to, you know, promote community engagement, particularly community engaged research. And so it may or may not be helpful to you, but I wanted to make sure that I walked through that so that you also felt like you can have a way to connect with some kind of university-based resources, particularly when it comes to kind of research partnerships that are geared towards health equity, which is what our Translational Science Center is responsible for, you know, facilitating. Okay, and then I'm going to get out of here and show you one last thing. So this is a PDF. So remember that QR code that I had in my presentation about those key parenting skills that my team has put together. I'm going to show you what it looks like. So this is the, let me make it bigger so you can see it. So this is the Partners Achieving Student Success, kind of like the material kind of packet. And so this gives you some references of all the different studies and things that we've published on this work, including a paper that really describes how this was co-developed in partnership with our community providers and was based on the core values that we decided were really dictating our work in PASS. And so it was a really, really collaborative and kind of community partnered project. And then you'll see that these are the key skills. So this first page on the left where it says key skills over here are all the 6 skills with some of the main bullets. So like, what are the key ingredients when it comes to family and school connections, for example? And then each key skill has a 1 or 2 page kind of deeper dive, if you will, that really is meant to be kind of a messaging sheet. So if I really wanted to work with a parent that was struggling with how to support reading at home, particularly if their children are now becoming English language learners and they are not, English is not the primary language at home, what are some ways you can support reading through kind of some of these key skills and messages? And we learned a lot from the application of these skills with several of our schools and community partners worked with predominantly immigrant communities. And so we saw that these were kind of applicable across communities and across different cultural groups. And so you'll see that each page has some information for you about how you might have some conversations with parents or individuals about parenting and supporting kids. And then we have these available currently in English and Spanish. But of course, if there's a need for other languages, we'd love to partner with other organizations about how to make these accessible to other languages. The groups that we were working with in our program were predominantly African-American and Latinx communities. And so that's kind of where this, the language versions were, why they were developed in this way. Okay. So that gives you a little bit of a sense of some of the resources that you can go to for more information about mental health messaging, about psychological first aid, about training and resources for you as community staff. And you can also feel free to reach out to me and I can see if there's any, other questions or things that I can help with. I'm, please feel free to let me know and I'll do my best to either connect you to resources or kind of follow up with your agencies individually about how we can make sure that you feel supported in the work you do with communities around mental health and well-being.